We just want to take care of people. We don't care what you look like, what you do in your own personal time, in your own four walls. We just want to take care of people.
I had a patient that was very, very ill, had a perforated stomach, and needed surgery emergently to save her life. She was going to die if we didn't do surgery. And I went in to meet with her with my residents, and we kind of explained the plan and said, you know, if you don't have surgery, you're not going to make it, so we need to go right now. And in the midst of all of her pain and distress, she said, well, I don't really want a black doctor. Is there anyone else? And, you know, at that point, you know, my skin is, you know, 6 inches thick at this point. And so I said, ma'am, I'm perfectly happy to walk out of this room right now. Just know that I'm the only surgeon that's on call right now. There is no such thing as a second opinion tonight. I'm the one that's going to be here. I'm happy to save your life. But if it's your choice that you don't want me to provide my services, then that's your choice. And I walked out of the room. I got a call back about 30 minutes later from the nurse saying she changed her mind. She wants to go to surgery. And I took her to surgery all the same, all that notwithstanding, because it's the right thing. It's my job. I don't judge people based on their beliefs, what they want to do. I don't care about any of that. If you come into the hospital, I'll give you the same care that I would give my own mother, because that's the oath that I took to take care of my patients.
I actually had an employee at the time. She was supporting our area. She came up to me on a day that I wore a very nice new dress. And she said, you look really nice today, but from here down, which then she excluded my natural hair. And it was pretty traumatic at first. I really had to take a step back and say, okay, is this coming from a place of, you know, ignorance? Is it coming from a place of, I just need to understand? Is it just being malicious? I didn't know.
When I reflect on my experiences, the majority of the aggressions have probably been from patients and or their advocates. I have been told once before that as the physician assistant in my team that the patient did not want to see me because of my color.
And so you're always checking yourself with our day-to-day lives, what you're doing, how you carry yourself, how you speak, your approaches and everything, because especially being African, I'm what they call it, a double minority. We call it a double minority. I'm a minority of a minority. So you're always just checking yourself, making sure that you are presenting yourself well enough that you'll be accepted. You always have to go above and beyond just to be at the basic level. So, yeah.
I think as a nurse of color, it's always been a challenge going through nursing school. It's been a challenge on the job. Like I said, there's not a lot of people who look like me in areas that I've worked in. And so you do feel that you have to work a little bit harder.
Not too many kids, when I go to my kids' elementary school, will just assume I'm a doctor. That's typically not the first response. If I tell somebody I work at the hospital, the initial assumption is not that I'm a doctor. And in the world, in 2020, in the United States of America, it just should not be that way.
It is exceptionally hard to have to do everything that my colleagues do and be black. I have to do all the stuff, I have to take all the risks, worry about getting sued if I mess up, being late to work, being tired, just not feeling like doing something some days. And then on top of all that, you see all the things that happen on TV and social media and read in print, and you just have to read that and say, you know, yeah, that could be me today, hopefully it's not. And still go be excellent at your job. The George Floyd video that, you know, kind of really set off everything else that's going on right now, I think, you know, the calloused indifference of those officers as this man begged for his life was something that transcended race, frankly. I mean, I don't know that anybody can really watch that video and not feel something.
I have gotten so used to putting a cap or a lid on my feelings. It has been difficult to come to work on a day after watching a video of another person who I see reflected in the mirror, or my husband or my brother, or even my father. And I come to work and everybody else is fine. Everyone else is in the hallway asking me, "Oh, hey Candace, how you doing?" And I'm like, I am hurting on the inside because I just saw another reflection of the same systemic oppression of people who look like me since I've been on this planet, and everybody else is okay, and I'm not okay.
So I've had friends, especially in the last couple of weeks, who have reached out and said, "Hey, I know that the world is not a fair place for you and that maybe it's hard to come to work. I just want you to know that I want to be an ally. I'm sorry that I haven't been the best one in the past. I don't know how, or I want to learn more. Can you just share more of your story with me?" That's been beautiful. I think taking care of patients that look like you and seeing the relief and the gratitude that's on their faces when you realize that you are making, I'm going to cry, but when you realize that you are making a difference in health disparities for people who look like you, when you realize that, oh wow, because of me, because I was here today, I was able to help someone who looked just like my mom or my sister or my brother, it makes all of it worth it, but it also just highlights how important this journey is